Good afternoon and welcome to Delivering Workplace Wellbeing, a live stream panel discussion and broadcast that will reimagine productivity and health in the post-COVID era. Today's live stream broadcast is brought to you by MEED together with Cigna. My name is Richard Thompson. I am the editorial director of MEED and I'm going to be your moderator and host for the next 90 minutes throughout this discussion. And it's a very, very important topic, as I'm sure you are all aware. Over the past 18 months throughout COVID-19, there have been growing concerns about the changing nature of workplace welfare, and in particular, the impact on mental well-being of staff who have been isolated by working from home. In addition to that, companies have faced increasing pressure on their balance sheets from reduced revenues and disrupted supply chains that have put up costs. And so at the same time as employees are facing new challenges from working from home or the sort of sense of isolation, companies themselves and employers are also facing new challenges in terms of costs. Today's broadcast will look at what those new challenges are, how COVID-19 has changed the landscape for employment and employers and employees in terms of the effects and impact on workplace well-being and health and wellness. And we will also look at what are the options for employers, and particularly for small companies, if they are trying to provide ongoing healthcare provision and workplace welfare provision for their staff, but are being squeezed on the bottom line. What are the options? What are the tactics? What are the strategies that they can employ to provide the best for their employees? So we will cover over the next 90 minutes many of the issues relating to this, and we will split the period into two sessions. The first session, from now and immediately after my welcome comments, we will hear a presentation and an opening keynote address from Jérôme Droesch, who is the Chief Executive Officer for Cigna in the Middle East and Africa and Southeast Asia. He is a board member for India and Turkey and Senior Executive Officer and Chairman for Cigna Insurance Management Services based at the Dubai International Financial Centre. And it now gives me great pleasure to hand over to Jérôme Droesch, the Chief Executive Officer for Cigna in the Middle East and Africa, who is going to deliver today's opening keynote remarks. Over to you, Jérôme. Thank you.
Thanks, Richard, for the introduction. Great to be with all of you this morning and to share with you our thoughts around both what happened during the pandemic in terms of COVID impact, but also in terms of productivity and well-being in the workplace. To start with, I wanted to share with you some insight around Cigna, who we are and what we do. So Cigna is one of the largest health service companies in the world. We are ranked number 13th on the Fortune 500 in the world. And in the region in the Middle East, we have started our journey around 17 years ago. And our goal is really to improve the health, well-being and peace of mind of the people we serve. We have more than 850 employees in the region. We work with more than 5,000 providers, so that's a very strong network of providers that enable us to provide access to care. We have a very large number of large clients, both multinational companies, but also SME and some individual clients as well. In the region, globally, we serve more than 1.5 million members, and we are one of the top 5 health insurance companies in the region. When we think about the world of today, there are a couple of things that have really changed since the pandemic. The first one is obviously more and more we have remote meetings as we do today. We are, all of us, working partially from home, partially in the offices. So it has really changed the way we work. We have also faced many periods during which there was a lot of restriction in terms of movement at the end of the lockdown. And also, I think we also have seen the huge pressure on all the healthcare system. Some of them have been able to react quite well, like in the UAE region. But in other parts of the world, as we have seen, some of the healthcare system have really struggled during this pandemic. What is very important when we step back and when we think about the way we work today and the way also we act as leaders is really the change of expectation from all our team members. I think they are all facing a very difficult period due to the pandemic, the fact that you have a lot of restriction in terms of social interaction, the fact that they have a different interaction with their managers, their leaders as well. So I think there is an obvious need for much more interaction and much more capacity to really check in with all our team members and really to make sure that we re-energize the team and that we take care of their mental health. So this is really something that stands out for us, that is really important. And we'll see later on in the result of the study how the employees are feeling about it. And we believe it's a real opportunity for us as leaders, but also as a health service provider, to provide solution to all the employees and all the employers as well, to make sure that they build and energize all their team in the best way. For us, it's always critical to understand the dynamics of the market to make sure we do provide the best solution to both our clients and members. And to do that, usually every single year, we do a global study where we do and take the pulse of all the employees and people who are living in various markets across the world. So usually we studied in 10 different countries, and we have more than 10,000 participants. In 2020 and 2021, because of the pandemic, we thought it was even more important to really understand the dynamics. How are we living, through this pandemic? What's our thoughts? What's our impact, both in terms of family relationship, physical situation, financial situation, social situation, and impact in the workplace as well. So we've done something quite different from the past. We've done 5 different ways to really take the pulse of the situation of all the population in the various markets, including the UAE market. We've done that over 6 different continents, and it enabled us to really compare the situation from one region of the world towards another. The second element that we've done is really to understand how can we, as a health service company, provide solution to those employees who are really facing difficult situation due to the pandemic. So in order to assess that, we've done a lot of studies, peer reviews, case studies. We've partnered with Asia Care Group in Asia as well. And we've done a lot of studies around 11 countries and again, 6 different continents to make sure that we have a holistic view of what's happening and how can we really optimize the return on investment for every single one of you who is thinking about implementing new solution for your team members. I wanted to share with you now a couple of very interesting results around the Wellbeing Index. And we can, as we can see here on the screen, we have really compared the pre-pandemic situation with the post-pandemic situation. As you can see on the screen, the UAE is really standing out. It's a market with the highest Wellbeing Index compared to any other place in the world. That's really an amazing result. And I think it's thanks to all the action taken by the government, but also by the business community as a whole. What is also very interesting to note is the fact that not only the index by itself is by far the highest, but also, as you can see on the screen, we are also already better than the pre-pandemic level. And it's quite unique, as you can see, because in most of the places, the level of the index is still below what was the index level before the pandemic. So I think that's the first element I wanted to share with you. The second very interesting element is the fact that, as you can see on the bottom part of the screen as well, in all the cases actually, on the 5 different dimensions, the index has increased compared to the pre-pandemic level. As you can see here, where it has increased the most is on the family side, with plus 2.6 points on the index. And that I think really is the results of what's happening for all of us, meaning that, in view of the change of the lifestyle, the way of working, the interaction we have, many people have refocused on their family relationship. And we all understood that the family is something extremely important for us to find our right balance in our life. So I think that's the first element that is really very important. The second one is the physical aspect. I think everybody has realized that obviously we can all be affected, unfortunately, by the COVID-19, but our capacity to react and really to find the right way to react against the pandemic is also linked to our own health and our own physical situation. So many people have decided to allocate part of their time that they save maybe to go to the office to different activities, including the physical activity. And as you can see, the index that was actually quite low compared to many other index has really improved dramatically compared to the pre-pandemic level. As you can see, the only one that is still quite low, even if it does increase, is obviously the financial index that is still below the average of the other index. And I think it's nothing surprising because obviously the pandemic has put a lot of pressure on all the companies. And as we can see, it still has some impact and probably some threat in terms of mental health as well for all the population in the market. But on the other side, what is interesting is in terms of work, we are already above the pre-pandemic level. It means that globally, again, as a business community, we've done a good work to really re-energize the team and make sure that the team is really engaged and can deliver the best capacity of work. Now, if we move to some really deep dive on some elements that are really extremely impactful in terms of the health of the population we serve. One important element that we've seen already in the past years, even pre-pandemic, is a very high level of stress in the market. I think that was always the case. It's mainly driven by a couple of things. The first one, as you can see here on the screen, is what we call the always-on culture. What it means is basically we are all connected on our smartphone. It's probably the first thing we do when we wake up in the morning, but also the last thing we do before sleeping at night. And as you can see, the level of stress generated by that is much higher than what we can see both in the UK, in Spain, the US, or the average of the world as well. So as you can see, this is still something absolutely critical. It was already the case pre-pandemic, and we highlighted that a couple of times in the past years. But I think it's even more true in the world of today. So what we can say is definitely the technology has enabled us to stay connected in the period during which there was very low, if any, social interaction. But at the same time, it has really increased the level of stress for all the population in the market. And that's absolutely important. As you can see on the right-hand side, there's a couple of other aspects. One of them is obviously the long working hours. And I think we all experience the fact that in this new way of working, the difference between our personal life and our professional life is now very narrow. It's sometimes difficult to find the right balance. People are working much more over the weekend, and all that leads to much more stress level. It's also important to understand that stress is not something that is neutral to our health situation. As you can see now here on the screen, we've wanted to highlight to all of you the top clinical manifestation of stress and what it could generate to all of us in terms of our own health issues. The first one obviously is heart disease. Second one is mental health problem. As we've seen, there is no single day during which we don't see article in the press about the level of increase of mental health. That's definitely a critical aspect that we can see rising after this pandemic. But we also have other problems like gastrointestinal problems, obesity, and many others like diabetes, cancer cases, and others. So as you can see, for us as leaders or for anyone, really managing the level of stress of our team and ourselves is absolutely critical. So it's something we really work on hard and making sure we do provide solution to all community, both clients, but also members, in order to make sure that we reduce the level of stress and we don't reach a level where stress will be detrimental to the health situation of the person. As you can see, the employee expectation has also changed. They are realizing the importance of healthcare. I think for all of us, we all understand that's probably the most precious asset for all of us. And we do have much more expectation, both in our personal life, but also very importantly in our professional life. So as you can see, the level of expectation regarding mental health support is really increasing. And today is close to 70% in terms of what is the level of expectation for all the employees. So it's really something absolutely critical for any single employer and head of HR to really take into account those elements that are critical. Another important element, and I think we have all experienced different situations during the pandemic, is what's our real expectation in terms of way of working? And I think if we step back and before jumping into those numbers, I think what we do see obviously, and we've seen that both in the region, but also now in some other region where they just reopen up some restaurants, is really the rush for anyone to have much more social interaction whenever it is safe to have it and whenever it's possible again. To some extent, it's a little bit the same in terms of work relationships. So I think at the beginning, when we did observe the situation at the very beginning of the pandemic, people find it quite convenient actually to work from home because you find much more flexibility, you are close to your family, you feel safe at the same time. But progressively, we've seen a change in terms of expectation. And as you can see, more and more along the way, the number of people who really wants to work fully from home is now very, very narrow. And it leads to only 1% or less than 2%, let's say, of the population really wants to work from home fully. Most of the people actually wants to have a kind of a hybrid situation, meaning partially working from home and partially working from the office. And a small number of people actually wants to work fully in the office, but only around 20%. So I think it's something extremely important to get and to step back and reflect on it for probably two reasons. One is in terms of culture in the region, in many cases, we still see a lot of companies who are willing to really work fully from the office. Because that was part of the historical culture to make sure everyone is in the same office at the same time. The second element is implementing a hybrid solution is not as easy as it looks like, and for many reasons. If you think about it this way, on one side, from an employee perspective, I think what they expect from a hybrid situation is a capacity to access work from the office whenever they want, and then to work from home whenever they want. So basically, they are looking for a fully flexible solution where they are fully owning the solution and they manage their time the way they want. Obviously, from an employer standpoint, it's quite different because many companies have tried to optimize their cost efficiency, reducing office space, and they will have to manage situations where it cannot be only based on the willingness of any employees to join the office, but finding a way to have a rotation and finding a way where you can also have some brainstorming session when it's needed with all the team at the same time, but also sometimes where people are working fully from home, so that all in all they can manage the office space at the same time. So as you can see, I think we'll have lots of debate moving forward on the way to design the best solution to make sure we find a hybrid model that is really efficient, that enables also anyone to benefit both from social interaction, informal communication, stay energized, but also at the same time benefit from the flexibility from working from home. When we think about the other important dynamics, one important one, and we really seen that at the middle of the pandemic, was the importance of digital access to care and virtual care. As you can see here on the screen, more and more people feel comfortable about accessing to care and for various reasons, whether it is for general advice, but also prescription that are very high, but also other type of checkup or consultation. So as you can see, the appetite for virtual care has never been as high as it is today. And we strongly believe that this trend will continue moving forward. Obviously, there are some limits in the case where you absolutely need to have a physical consultation, but more and more we do believe that access to care will be a combination of both type of physical and virtual access to care. I think we also wanted to share with you the solution and what we can do really to have a positive impact to the population in the region, and how can we enable them to benefit from various solutions to really be in the best place, both from a mental health solution, but also from a global whole health person situation. As you can see here, we've made an assessment of the various programs and how it could have a positive impact to the population with a return on equity. So as you can see here, the first two ones are basically, the first one is case management. So basically really making sure that we do provide the best advice to anyone who is facing a severe issue, making sure we provide the best access to care at the right moment in time of the disease, and making sure they have the best medical output so that they get healthy as soon as possible. The second one is all what is disease program, and disease program could be related to chronic management, for instance, like management of diabetes and other program. But what is very interesting here is those one are quite, I would say, classical programs that we've done for many years in the region. But as we can see here on the page, now it's becoming even more important as well to have also some prevention program in order to make sure that not only we manage cases where people are facing health issues, but we anticipate and we really help people stay healthy instead of getting to a situation where we need to support them because they will face some disease. And this is actually true both for prevention, but also lifestyle management program. I think, as you can see, the level of savings are quite important, both for lifestyle management program, but also for case management program. And the savings could both have an impact in terms of healthcare related costs, but also what is related to absenteeism and also productivity gains, as you can see on the screen. So when you look at the combination, obviously it has a huge impact, but what is really important to understand here is it has some benefits both for the members, but also for the clients, meaning that any companies who implement those programs will benefit both from some reduction in terms of cost of healthcare, that obviously will have an impact moving forward in terms of health premium, but also in terms of absenteeism, but also in terms of productivity. So all that will have a high impact in terms of return on investment for the company. And at the same time, it will really improve the health of the population, of the team, that will obviously impact also their capacity to be really energized and to deliver the best level of efficiency. I think when we just think about how can we implement those steps, and I will not go into the detail, but I just wanted to highlight a couple of elements. Obviously, in the usual practice, in order to implement the right wellness program in the workplace, we cover usually 5 different pillars. The first one is to recognize the business loss drivers. So we need really to make a deep dive and a real study with the employee data to understand which one are the key elements we need to solve. And actually, it could be quite different from one type of company towards another, based on the team members, based on the current culture, based on the current situation of the company. The second one is, based on those data, is really to develop an effective program that will really enable to optimize the efficiency of return. The third pillar is really to measure the success. And obviously, it's really important to make sure that we understand what is the impact of the program. Is it as impactful as expected? Do we need to correct some of the action? Do we need to make sure it's really fit for purpose? So all that will be seen through the measurement of the success. And the last one is really to make sure that we maintain the engagement along the program. And that's always absolutely critical. As we all know, all those programs can only be really impactful as long as we make sure that people are engaged and that we engage the most important part of the team. So we'll just stop there. And I think we'll now enter into a Q&A session, and I will leave the floor back to Richard. Thanks for your attention, and very keen to answer your question.
Well, thank you, Jérôme, for that excellent presentation. You presented some very important and interesting data, and I think your keynote remarks set up the discussion for the next hour or so perfectly. So before I introduce the rest of the panelists, Jérôme, I would just like to come back to you to follow up on your points. I mean, that was your data, your presentation was covered quite a lot of ground, but I want to focus particularly on the mental health areas of worker welfare. This is a topic that is being increasingly openly talked about, which is, it's good that it's being talked about. But what for you is the key trend or the most important aspect of sort of the stress levels facing employees in the current environment and in the post-COVID environment?
Yeah, you're absolutely right, Richard. I think stress and mental health is definitely one of the key highlights of all what we've lived, through during both 2020 and also 2021 with the impact of the pandemic. So, a couple of key highlights here. First, as we can see, there is a strong correlation between stress and mental health. So it's definitely, linked. The two notions are very linked. The second aspect is the level of stress is really, really high. That's what we can see in the study. And in the UAE, we have, unfortunately, one of the highest level compared to many other markets across the world. And there are a couple of reasons for that, both around working hours, working on the weekend. But more importantly, I think the key highlight in the region is really the fact that people have a kind of always on culture. So what it means is the first thing people are usually doing when they wake up in the morning is, switching on their smartphone, checking their emails, whatever they have. And then they do that all over the day and until probably the last thing we do before we sleep as well. So I think that's definitely something very important in terms of highlight. So I think one interesting thing is technology, when we look at what happened in 2020, was really a strong support to connect with each other when there was no social interaction. But at the same time, it has created a lot of negative side effects, as I've just mentioned. So we definitely need to make sure we find the right balance between using technology, but also finding times where we just switch off and it takes some time for us to make sure we reduce the level of stress to avoid any medical consequences related to stress.
Okay, just as you were talking there, I don't know if you can answer this question, but is it possible for us to sort of self-identify our levels of stress by assessing how habitualized we are? You know, if we immediately go to the phone when we wake up and last thing at night and throughout the day, can we actually use that as an indicator of stress levels? Maybe it's not possible to answer that.
I think it's very interesting because you have we see more and more tools every day that are providing some measurement. We've created a quite innovative tool as Cigna, where we combine both your brain activity, your skin activity, and also, all what is related to your heart activity. And based on that, we are able to really measure instantly your level of stress. Unfortunately, it's not something we can provide remotely at this stage, but we are working around different tools to make sure that in the future we are able to measure instantly the level of stress, because today we can measure our weight, we can measure our blood pressure, but we are not really able to really measure the level of stress. And it's very interesting because we've done a couple of campaigns, and what we've seen is many people were actually very surprised by their real level of stress. Some of them believed they were not stressed at all, and the reality was quite different. So you're right to point out this question, because probably moving forward, understanding that kind of level of stress is critical, because as we all know, if you're only exposed to a certain level of stress, you will probably not have a severe consequence to your own healthcare. But if you are under severe stress level, then you will probably have very negative consequence to your healthcare.
I'm also interested in your comments about in this region and in the UAE particularly, the stress levels are high because, not only are we switched on all the time, because many of us are international companies and because the GCC and the UAE are global hubs, we're working across time zones that extend our working days and also different working weeks. So we've got that effect as well as the kind of sort of working from home and all the other factors.
Yeah, it's definitely, something that is impacting us as well, because many of us are working for multinational companies, and so we are connected not only during the work days, but also during some of, or at least part of the weekend as well. Many of us as well are connected, for long hours, because we start early morning, sometimes connected with Asia, and the opposite, connected with Europe or the US late evening as well. So I think it definitely creates some further challenges compared to other regions of the world that are less connected. I think it's both the positive aspect of the UAE, that is a great hub for many regions, but at the same time, it does create some challenge. So we need to make sure we find that kind of balance, and making sure also we set the tone as leaders towards our team, making sure we provide them the right advice, and making sure they really find enough time to switch off, both at night, but also during the weekend as well. So I think it's something very important, just to make sure that whenever we send an email to our team members, that we don't expect an answer in the next 5 minutes or so, but we give them time as well to find the right balance. That's absolutely critical.
Well, thank you, Jérôme. I mean, those are such important remarks, and we will come back to them. And I want to introduce the rest of our wonderful panelists. Today we have with us, as well as Jérôme, we have Linda Jarnhamn, who is the founder of Flow to Thrive. We have Christine Belanger, who is the Senior Vice President for Performance Development at Mubadala Health in Abu Dhabi. And we have Peter Makszin, who is the Total Rewards Leader at EY in the Middle East and North Africa. So welcome to all three of you, all four of you, I guess. Thank you very much for your time today. Linda, if I can just come to you first, and perhaps you could tell us a little bit about Flow to Thrive, your company, first, to just briefly tell us what it does. And then I'm interested to hear perhaps your keynote thoughts on the workplace well-being challenges for employers.
Absolutely. So, hi everyone. Good morning. I think we're still in the morning zone. Flow to Thrive is a company that helps organisations to optimise their employees' health and performance. So, really to help you develop corporate wellbeing strategies that have an impact. I really had a good thought when we talked about this last week, and I think the pandemic has obviously had an impact, but I think it's important to remember that we've spent the past 50 to 60 years perfecting what I call destructive productivity habits. we work and live in ways that are opposite to what our brains and bodies were built for. And this has really caused an absolute avalanche, as we know, of physical and mental illnesses. And the pandemic has just simply added another layer of complexity and severity to what I think is actually a much more an already existing silent pandemic. So mental and physical issues have escalated and increased phenomenally, I think, over the last year to varying degrees in various regions across the world, depending on how we've been impacted. With this, companies' attention to the issues have also increased. But I think there are still a lot of questions around the value that corporate wellbeing programs can still provide or are actually providing to organizations and their employees. And I think there is still a reluctance to spend meaningful sums of money on the same. So I was sitting in the office of one of the world's leading professional services firms just before the pandemic hit. And I think this story is still very valid today, 1.5 years in, or 1 year plus in. I was meeting with the head of wellbeing, and she shared some of her concerns with me. And she said, I know we're doing a lot across our markets, across our business units, but I don't know what, where, and why, or indeed if it's having any impact. I can see a lot of activity, but I have no idea if it's having any impact on our employees or on our business. And this sort of takes me to the 3 points I wanted to use to trigger the conversation for today. And that is that, number one, I see very often that rarely are issues properly defined. So the vast majority of programs that I see are still based on guesswork or with a poorly or undefined baseline. And there is often a lack of clarity on why companies are spending time and money on corporate wellbeing initiatives or programs. So many are rolling out initiatives with no aligned real purpose, vision, or clear objective. And this, I think, is linked to one of the key points that we want to talk about today, is that value then becomes unclear, and cost is one of the discussion points of today. And I think cost only becomes an issue if the value or the impact or the outcome is unclear or undefined. So I think this is the problem, that many organizations today are still shooting blindly at unidentified targets, trying to solve issues with solutions that will never solve the issue. And for me, the big question is, where else in an organization would you do this? And I think nowhere, but still, that's what most organizations, the approach that most organizations take today to corporate wellbeing strategy and programs.
Wow, there's a lot in there, Linda. Thank you very much. Just quickly, I want to bring in the other panelists, but just to come back on your point about value. I mean, it's such a massive topic. So if you can summarize it in one sentence, what I mean, surely just the number of sick days, that tells you if, you know, the impact on, you know, if people aren't well, they take days off. And if you see your sick day numbers going up, then you can see the impact or the value there. Or is that too simplistic?
You want me to do this in one sentence?
I was being facetious with that, but yeah, just to sort of check, I just think that's a very interesting, surely we can measure this in some way.
Yeah, so no, number of sick days, I think, is just one very, very simple way of measuring some form of impact. And I think this is back to the lack of purpose or objective of a program, because I mean, one, for example, financial services firm in the UK, after a year-long program, they actually, as a leadership team, they took the decision to scrap and abandon all their targets that they initially set, and the only thing that they measured was actually the people they took out of the risk zone, because they realized that there were so many people who were high at risk of burnout or some other form of illness. So I think this is the critical part, is to understand and define what it is that you want to measure and what it is that you want to achieve. And after that, you can decide whether it's sick days or something else.
Okay.
Presenteeism has been proven to cost much, much more than absenteeism. And we can go into that later. But for me, that I think is something that I would focus on as an organisation much more than the sick days alone.
Okay, thank you very much. I was really just trying to, I mean, it's clearly the sick days thing is just, it's way too simplistic. I just thought it might trigger you a little bit, but okay, thank you for that, Linda. Christine, if I can come to you. So Christine Belanger, you're the Senior Vice President for Performance Development at Mubadala Health. And obviously Mubadala Health, as well as your day job, you've been involved in the HOPE Consortium and other initiatives in Abu Dhabi relating to COVID and the immunization program. So you've got several different perspectives on this issue. But what are your thoughts on the challenges for employers in the sort of new normal after, or the next normal after COVID?
Thanks, Richard. The thing here is what is the new normal first, and there's multiple areas that we need to consider. So it's not only about the new normal, is what does it mean for us? So we know that, as an example, in the past maybe 2-3 weeks ago, the government has announced that organizations in the UAE can go back to 100% occupancy in their space. And you could see when that message came up, the reaction of people, and it was like the whole spectrum. Some people were super happy because for them, going to work is amazing. It's 80% of your day, and staying at home was like very almost I can qualify as it was a depression state. They wanted to see people, they wanted to be next to their colleague, peers, and things like that. So there was this ecstatic state. And to the other spectrum, you had people saying, oh no, I cannot do that. I'm not ready. Some schools are still closed. There's still a school at home, and not being at home, and both parents working. Now it's a struggle that goes back. And then you have the people in the middle saying, wait a minute, I was 100% in the office, then pandemic, 100% at home, and then 50-50. How many change am I will have to absorb, and when this will just settle? So all of this, basically, for an organization is to really think about their employees and what fits best. And I do believe that it's time for organization to showcase flexibility, creativity, and enabling like kind of a hybrid approach. So yes, you can go back 100%. But why don't you look and offer something to your employees if they want to avail some working from home days? That is part of your policies, that it's not a big deal with the awareness and the okay and coordination with your manager. So that's one thing. And I think it will help a lot in terms of reducing the anxiety, absorbing or relaxing a little bit the change management that gets less resistance and more easy to absorb. So I would say that that's one point in terms of the organization, and also figure it out how you can stay financially healthy if you don't go back to 100%. Or if you still want to have rotation, and how you will set up your office space to also click and say, now we have the time to look at how people work, to the point of what Linda has mentioned, how people are working and how we can bring more healthy way of working. And we've seen like offices saying, you know what, we took the time of the pandemic to relook at our office space, to look at the way we are set up, to have a desk that goes up and down, to have more, chairs that are more ergonomic, to relook at the way we set up meetings, instead of 1 hour, 2 hours, why don't we do 50 minutes meetings? So we have a hard stop and we give 10 minutes to people to just take a break and so all of those, that's the organization that must think about that and provide the guidelines. So that's in a nutshell. So I can speak a lot about healthcare, but
well, I mean, I'd be delighted to come on to that as well. Just So it's quite clear that you're strongly advocating that for corporates, they in a strategic sense, they need to think more flexibly. They just have to accept that that's what people, there's different needs, different stress levels, etc. And that makes a lot of sense. But just to follow up on the points from Jérôme and from Linda. So Jérôme talked about, the stress levels increasing. So, as my first question to you, I'd wonder if you have any observations from a Mubadala Health point of view, if you have seen that in your patients or in your staff, that stress levels. And then Linda's point, which I think is probably, the critical thing about measuring that, how stressed people are and justifying the value or the perceived value in workplace welfare as a corporate strategy. What sort of thoughts do you have on those two areas?
Well, I would say, and the first point in terms of stress, anxiety, what we have noticed is two things. So yes, the pandemic has kind of opened the box and enable looking at those. We had some conversation with psychologists, psychiatrists, neurologists, and they were indeed saying like, the level of patients coming for depression, severe anxiety, attention deficit disorder, hyperactivity that was created or created because of the situation didn't just go down because of the pandemic. Minimum, it stays the same, but in reality, there's been a peak. People do go and say, I had fight with my spouse. I cannot handle my kids at home. I don't know if I'm going to keep my job. It's a whole level, very quickly hit hard people. As a human being, there's so much you can handle. As Jérôme was saying, it's okay to have like a one moment stress. It needs to go at one point. Here, what we had is a continuum. And this is where your health is affected. So how many people gain weight? Start addressing their issue with other means, to try to relax, de-stress, sleeping pills, anti-anxiety. So yes, our physicians have indeed realized that there's been an increase and trying to provide the services to that, indeed. And your other point, sorry, I lost.
The other point was Linda's. Maybe we can come on to it later, but it was Linda's point about the perceived value of investing in workplace welfare strategies and actually, putting money in the wrong place. Traditional methods. Not. Any thoughts on that from a healthcare point of view?
Absolutely. So for us, there is, and coming also from myself, and I think we're all going to agree, is like this well-being, wellness thing that was a trend and beautiful and a nice to have. That time has passed. Now it's really important for the people in the organization who have implemented or thinking of implementing, but who have implemented, to be credible and to be strategic. So you had 1 year, 2 years, 3 years. That thing has been coming and bringing and implementing. Now measure what's the results. And this is the right of an organization to go to their wellness team and says, show me the results. Well, how have we improved? Are we tackling the right issues? Are you able to adapt quickly to new issues? What's next? What can we bring to continue supporting our employees? Now it's time to be data-driven and look at that, look at the history, and then make the right decision. Because wellness is there to stay, but it needs now to be really supporting the organization to cope and to resolve and to increase employees' mental health and engagement and motivation. Because we know that wellness is the little thing that can tip and improve employee performance and engagement. It's not only bonus, it's not only rewards, it's not only that. You need that wellness and rightfully implemented and monitored to make that change.
Okay, fantastic. Thank you, Christine. Now, Peter, thank you very much for your patience. You are so you're Peter Makszin. You are the total rewards leader for EY, one of the world's biggest, consultancy firms, and you cover the Middle East and North Africa region. So just as a sort of to set up your keynote thoughts, what are your observations as an expert, as a consultant in this area on the new challenges for employers in workplace well-being?
Well, thank you very much. I feel like it's going to be Judgment Day from Linda and Christine's perspective, because what I'm going to be speaking about is what we have done so far, and they're going to be either saying, yes, you're doing the right thing, or no, you're doing something wrong. So I think to one extent, the very early days of COVID, what we have done and built out an infrastructure of local well-being champions, internal portals to share a lot of contents, set up the technology for running sessions. But then we ran into the question of, yes, but we need to fill this in with content. And that's when we were, it's not a secret that we've reached out to external, support, global providers, local ones, to bring in experts and start supporting our communities to, on nutrition topics, breathing, postures, resilience, a wide range of topics. And surprisingly, in some extent, we ran into the limits of technology, because more people were interested in joining these sessions than we could allow. So there was a increasing number of sessions, day by day, week by week, and a lot of people attending. So that was number one, what we have done. Number two, moving into my specialist area, which is the healthcare support. At the year end, when we were renewing our policies, there were two critical aspects that we wanted to make sure that we incorporate to our new coverage. One is any possible access to digital content and digital knowledge about health issues, wellness, everything which is out there, and multinational, healthcare facility or healthcare providers pretty much were ready at the time to support that. The second one, which is employee assistance program. So we try to incorporate employee assistance program into our healthcare coverage. For two reasons. One is extremely easy. We don't need to deal with the sourcing of it. That's the insurance company does it for us. But second, and probably foremost, is that once you go through an employee assistance program and something more significant issue is identified, which is beyond the limits of employee assistance program, then you can switch on to your medical coverage, assuming that you have psychologist to psychiatric coverage in your scheme. So that's a flow. Employees don't need to start from scratch, and we discuss the topics with the specialist. And that leads me to the third point, which I wanted to raise. Before COVID, when people were predominantly working from an office environment, having any kind of well-being issue was probably first observed by colleagues, line managers, people around the office. So employers had sort of the obligation, but the opportunity to train these colleagues, and to how to support such cases. Now, with the blended working environment, or in the past year, working from home, this role has actually shifted to the family members. So the spouses, older kids who are old enough to observe certain behavioral changes, knowledgeable, etc. So what we try to achieve, and we are in very early stages of that one, is to reach out to the family members, to let them know that what resources we're providing for their EY working spouse, what services they can actually be covered, because EAP services does cover dependents. Medical insurance does cover them. So we want to engage them and make sure that they're equally aware of the opportunities that we provide for the for our employees. And I think that's one of the points that we can keep on discussing, and prompts another question: that how do we deal with the singles? Well, that's an interesting topic, and probably all of us can contribute. Yes, singles, they don't have the spouse and the family members at home to support them. I would assume that probably those will be the ones who will predominantly go back to an office environment. So then we're shifting back to the pre-COVID situation. These are the things that we need to balance out in the future.
Fantastic. Well, so, again, a huge array of topics there to dig into. I'd like to, so Linda, when she was talking, mentioned, working with a big consultancy firm. So EY obviously is as big as it can get when you talk about consultancy firms. And Linda's point was about the value being unclear in terms of workplace welfare initiatives and strategies. At EY, Peter, do you have, that you've outlined an impressive list of initiatives and some of your thinking. How do you quantify the value from this work? How do you sort of report it, and how do you know if your time is being put in the right place?
Well, there are two ways to measure it. One, I think the number of participants is actually justifying whether we're going in the right direction or not. So if there is more interest and the word is spreading out that these sessions are actually valuable, then I think we are on the right step. The second one is time to time we have what we call is like internal check on the people on how their well-being or whereabouts and feelings, and we do have a positive response on they're feeling better, they're feeling being supported by the employer. So we used to call it people survey, which ran on a biannual or annual basis. We do a more condensed surveys, but a lot more frequently. So we see a positive trend coming from the people that they're actually valuing these services and they feel a little more supported than before, especially being away from office when you can't really discuss these matters face to face with anyone.
I think it's quite an interesting point that you made about with the hybrid working model and people working from home. Does the responsibility of the company now extend to the home environment? It's quite a big philosophical issue, I suppose. But and to family members, I think that's quite an interesting thing. You mentioned, Peter, at the beginning that you felt like this might be Judgment Day because you were going to set out some of the stuff that you have done, and that Linda and Christine might sort of come in on some of that. So I'm going to invite them in to judge you now. Linda, I just wonder, and Christine as well, do you have any, I think that Peter's very kindly set out some of the things they're doing at EY. Linda, do you have any thoughts or questions on what you've heard?
Yeah, absolutely. So I think if we pick up on the first bit around awareness and a lot of the sessions that seem to be very popular within the organization, I think that's a very absolute first step to take, to increase the awareness and to increase people's understanding of the impact of their health on their performance. So I think that's a great first step. I think it's brilliant that you're bringing the family then also into the programs, because that takes it to the next level around changing habits. So it's around increasing the opportunity, if you like, to identify if there are issues with someone that you don't meet and see face to face and help get the family involved. But also with a lot of these things, it's actually, to change a habit, you need to involve the entire family. And I think particularly now when we are working from home, where often the things that we used to miss, i.e. our family, has now often turned into the greatest stress, the most stressful factor. So actually to have a conversation and understand why and what it is that's driving stress at home and why someone might not be feeling well, I think that's a great step, because you're really taking it to the next level around starting to change the way you do things and the habits that you have at home and at work.
Christine, I can see that you've switched your microphone on.
I tried. Sometimes there's noise and things like that. So I think that there's two other points that were very important that Peter mentioned, is the healthcare policy, but also KPIs. Because at the end of the day, there's this part of being able to convince and get buy-in from the leadership of an organization on as an example, the employee assistance program. And it's normal, the organization will say, why do I have to pay for that? Why don't we just, provide materials, or you don't just run session, or you don't just do spot checks? Isn't that enough? So having the right KPIs and demonstrating the added value and how the wellness has helped support employees and improve the morale, the wellness, or at least help also improve to cope with that, and not to lose the employee to presenteeism or such a thing, or sick leaves or such a thing. The other thing is the healthcare policy, and that is a really important point, that our healthcare providers do, if not already, do provide those type of services, and include as, you know what, that's normal. That's just normal. Just provide webinars, provide courses, but also have the psychiatrists included if not done already, and having another look and adapt to that. So I think from what Peter mentioned, those are the 2 points that really strike me.
Okay, thank you very much. Well, sorry,
yeah,
Christine.
Not so bad of a Judgment Day.
I was going to say, Peter, do you feel judged?
I feel, and I feel like we're on the right path. Let me just add one more point, that, so well-being is not because of COVID. So well-being been there for a while. And just as anything else, it started like, okay, let's create an awareness. It's slowly picking up. People are aware of it. But then COVID hit right on the head, but it's all of a sudden was a rush and a need that should be beyond just an awareness level. And that's why I think we all had a little bit of struggle in early days, and firms like Linda and some other firms being out there to help us to quick start that and get into that with a much faster pace. So I think those who are not there yet, that's because they couldn't pick up that pace. And just creating an awareness was not enough for well-being or EAP. In normal years, we've been talking about EAP for years, and we said, okay, we're rolling out 3, 4, 5% pickup rate over the course of a few years, probably goes up to 15, 20%. That's a reasonable level for EAP. All of a sudden, 4, 5% won't be enough, because then they won't get the necessary support. So it's just not just an awareness issue. It's like a heart of an organization. It has to be there and has to be working. As Linda said, if you don't go the right direction, you're just wasting money.
It's interesting. One of the most common themes that I've heard in all these discussions and webinars is so many of the trends existed before COVID, but COVID has really accelerated a lot of things, whether it's digitalization or workplace well-being. It's a common theme. Okay, we've got 30 minutes remaining on this discussion, and we've got loads of questions, which I'm going to come to the questions now. I will just go through them as they have come in, so that the sequence might seem a bit random, but I'm just going to try and get through as many as possible. Now, Jérôme, I'll come back to you. You talked about, in your comment a moment ago, you talked about stress levels, and there are a few questions here about stress levels. So what should leaders be doing to help their employees manage their stress better? Now, so we've already heard some of the thoughts, but do you have anything to add on management of stress, and what can leaders do?
Yes, that's very, very important topics. And maybe just I want to bounce back on one question, the awareness, just to share with you the result of one study that was showing that for more than 50% of the CEOs today, they believe that healthcare is mission critical. It was only 20% before the pandemic. So going back to what mentioned by Peter, Linda, and Christine, I think definitely we see that kind of level rising. And I think going back to your point around the stress level, the fact that CEOs first realized in the first place the importance of managing stress and managing the well-being of their team is for me the first step, because without that, I think it will really be difficult to make any improvement. Now, in terms of stress level, a couple of things. Obviously, as I mentioned, I think first, the top management for me should really be a role model, and that's really important because they set the tone. They need to demonstrate what are the right behaviors, what we should avoid. I think an interesting topic we debated recently is around how do you make enough time in your schedule to have some times that you can free up, to manage various topics, because many of us, and many probably who are connected today, are struggling with a situation where basically you have a full schedule with one meeting after another. And it's very interesting, whenever I'm discussing with other CEOs, they all face the same issue, that we probably have more than ever a huge number of meetings, just one after another. So I think some companies are looking for a different model, either freeing up a full day or half a day. We've chosen the different model where basically we are trying to implement a solution where every single person will block some time every single day in their schedules that will allow them to do two things. One is obviously, if you have any urgent last-minute topics, you can free up some time and you can be available for any of your team members. And then the second is also it enables you to treat all urgent topics. And I think that's really critical, because if you just block it on the same day, it's not a given that you will have, it will be in the right moment of your week. Maybe it's another time where you need to have some times to switch off from your email or your meetings and get some time to reflect on a difficult topic. The last comment I would say is, for me, it's a very simple principle that I always share with my team member, is we should all remind that thinking is also working. So many people believe that actually, I'm good if I've got a full schedule all day long. But it's not the purpose of any company. The purpose of any company is to deliver what is expected as a global promise to your customers. So ultimately, thinking is also working. We need to make sure we step back and we do more efficient things and more important things and only the urgent things, because otherwise you can focus all your day on urgent topics. It doesn't mean that you will provide the right added value from a global perspective. So for me, there are a couple of things and principles and values we need to make sure we apply on a daily basis to make sure that we deliver the best output in terms of performance with all our team members.
Okay, thank you, Jérôme. Now, there are several more questions for you, Jérôme, that I think probably you've just touched on. So issues about how would you recommend we help our employees manage stress? I think you just touched on that. How do we find the balance, and how would you recommend we help? So that, I think you've touched on that in some of your comments just now. Here is one. I don't know if this relates or not. What are your thoughts on wearables, new wearables that offer stress level measurement, like smartwatches? And maybe as an insurance provider, Cigna maybe links this with policy prices or something, people who have data from phones. What are your thoughts on that?
So what I believe is that, long term, more and more we will see the combination of technology supporting all our members, both in terms of monitoring, virtual care, home care as well will be more and more important, especially for one reason, as you mentioned before. I think the new norm will probably be a kind of hybrid model where all of us will work partially from home, partially in the office. So obviously it will be the same in terms of accessing of care. So I think the monitoring will be a great enabler. We are definitely working on a couple of topics where technology will support, both in terms of measuring stress level, but also consequence of it, but also on other chronic disease management, like diabetes, for instance. So I strongly believe that technology will be extremely important moving forward, and that will be a driver of the future evolution of access to care and the way we do provide care in the future. So definitely an important element.
Okay, thank you very much. Just I don't know who to put this point to, maybe Linda. So following on from Jérôme's point about hybrid working models, somebody has asked, doesn't this make it difficult to track absenteeism? Is that a concern? It strikes me that getting the job done is easy to track, so it doesn't matter if someone's on or off. Is that an issue, do you think?
Both yes and no, because I think what's happened to a large extent is that many have changed their place of work in terms of moving from an office to home or from a physical to digital working environment. But to what Jérôme was talking about, we still have a lot of back-to-back meetings, the old working habits. We've lifted and shifted the old style habits and culture into very new environment. So I would say, no, it's not an issue if you're adapting your culture to the new ways of working. But I think a large proportion of organizations still today are operating where we're looking at output, and that's back to what the point Jérôme was making around working, and that's, you know, sitting in front of a computer producing is work, but thinking is also work. So if we can move towards a much more trust-based culture where output is the focus rather than the input, then absenteeism or tracking where people are becomes irrelevant, because it's what you what comes out and the outcome that becomes.
That's very interesting that you mentioned trust there, because going to your earlier point about measuring value and the sort of the difficulty of quantifying or defining what we're talking about, trust kind of is the it gets around having to identify it. You know that's the problem, isn't it? If it's all about trust, then you can't quantify it.
Absolutely, and trust is one of the things that we track in using the tool that we have, and it is tend to be one of the very lowest scoring points, together with psychological safety, for most organisations.
And if I may react as well, Richard, I mean, on
yes,
this
sure.
one, I mean, trust for me is absolutely critical. I strongly believe that, you know, what Linda mentioned is critical. We have really looked at different situations, and it was interesting studies in the US where they were comparing two different approaches. Some companies were even, you know, creating and putting some trackers to make sure they track the activity of their team members, and some others who are doing exactly the opposite. And we definitely believe that the second one is by far the best one, making sure that trust is critical, and it's more and more the expectation of any team members, and that's I think a key asset for the future is how can you really build that kind of trust relationship with all your team members, because that's the best way to have an inspired team that will deliver what you expect to deliver in the long run. So for me, it's absolutely critical to create that kind of trust within all the various levels of your organization. So communication is absolutely critical to deliver that. And I think maybe if I can share one other example, during the pandemic, we are doing a town hall every single week, just before the weekend, to make sure we reinsure our team members around the fact that all is going well, they will not lose their job, they will keep on a financial track, and also making sure we give them the right advice to switch off during the weekend as well. So for me, communication was absolutely critical to build that kind of trust as well.
Okay, thank you. Now, I know that we're not here to talk about things like productivity, we're here to talk about workplace well-being. But Peter, there is a question that relates to this sort of hybrid working model, and it relates to productivity. So, Peter, what are your thoughts? You know, we hear a lot of organisations are fearful of the working from home, and a lot of employees are countering that they feel more productive at home because they don't have the office distractions. Do you have any sort of comments on that? Is there any indication, or maybe Christine, you've got something on this as well. Is there any indication that working from home is less productive or more productive, Peter?
Well, we have asked employees a couple of times, and what we have seen and what we have observed in the past 16, 18 months is that productivity didn't drop just because people were working from home. I think what really matters here, and connecting that to the well-being, is that are they actually working the same amount of time at home versus the amount of time they used to be working in the office? Because then you compare apple to apple. If you work 20 hours at home, most likely your productivity will go up as opposed to being just 10 hours in the office. That's not the right direction. So what we need to achieve, and I think we have done a pretty good job on that one, is stick to your working hours at home. Be as flexible as you can, because we are in a flexible organization, and I think I'm really in a very good position because my supervisor is even probably more flexible than anybody in EY, and that engages me. I feel supported by the organization, so when I'm actually working and sitting in a computer, I'm probably going to be twice as much effort just to make sure that I'm doing the right thing. That increases productivity. And let me just go back to one point where Jérôme mentioned that once we start measuring things, whether it's absenteeism or stress level, we need to know what we want to do with the results. If we are not prepared for ourselves how to manage stress level, it's going to create more stress. So I'm not really a fan of these smartwatches, measuring my blood pressure and stress level, because then I'm going to be in a situation that, what on earth should I do right now? I would rather, sort of put out the knowledge for the people that if you feel stressed, this is what you need to do. Measuring it, there's probably been, equipment out there for the past 100 years to measure blood pressure, everything. It's not about measuring, is how to deal with that. I think that's what the employers, insurance companies, external providers come into the picture.
Okay, thank you very much. Now, I'm going to shift topic a little bit onto cost of providing workplace welfare, and we have a question here. It relates to the second question on our poll. So I'm just going to read out, if you go into the poll tab on the right-hand side, I'm just going to read out the second question. So the second question on the poll is relating to affordability and health insurance. And the question on the poll is, with the increased pressure on budgets, what is your health insurance plan for your employees? So it's asking employers about their plans. Now, the questioner, relating to that poll, if I just scroll up, right, the questioner said, it's interesting to see from poll 2 that cost is very important. For small and medium-sized enterprises, SMEs, insurance costs are a huge extra cost. Insurance premiums are far too high in the UAE, and the endless hassle associated with claims is very frustrating, along with having to ask permission for everything. So, Jérôme, I'm going to come to you as the representative of the insurance industry and as our partner for today's broadcast. I'm going to put you on the spot then. What can particularly small companies do to provide the best healthcare or well-being without all of this hassle?
Yes, thanks for this great question. Obviously, I mean, we all understand that the cost of healthcare is an important factor for any SMEs, and probably sometimes more difficult, obviously, to absorb compared to any multinational companies who have larger resources, especially when you face such a pandemic and important economic crisis. Now, I mean, just to give you some relative figures, the average spend on healthcare in the UAE is probably around $2,500 per person in average. In Europe, it's probably around $5,000, and in the US, it's around $10,000. That's the first element we need to take into account. So definitely, as you can see, even if we believe that the premium are quite high, we shouldn't forget that in many other regions of the world, part of it is captured by the government. Here, the full spend and the full cost is paid by the program of healthcare. That's the first factor. The second element is, we all understand, as I mentioned, the importance of healthcare, and we do believe that for various reasons, healthcare will continue to improve. Hopefully, I think that's good news for us, but at the same time, we need to spend more and more cost dedicated to healthcare for the long run. If I just mention some short-term impact and long-term impact. So on the short term, if I look at what's happening today, basically we are back to normal in terms of access to care. So people are consuming the same amount of care than before the pandemic. But on top of that, you have obviously all the costs related to COVID-19 and the different side effects as well, as we mentioned. Some of them, like the delay that was unfortunately happening on some treatment, like cancer cases and others, have increased the severity of costs. So you have a couple of other factors. So definitely, what we see in 2021 is an increasing volume of spend on healthcare. If we think more about the long term, fortunately for us, there are some new treatment coming in, and that could solve many issues in the long run. I think about gene therapy treatment, for instance. We are the first company last year to bring one gene therapy treatment for a young lady. We saved her life, but the cost of just one injection was $2.5 million for just one injection. So you just imagine the cost for one treatment. Obviously, now if you think about it differently, when you are the parents of this young child, how do you feel if you are not covered for those kind of situations? So more and more, I think we need to understand that, yes, you can access to different treatment. It's probably coming also for future cancer cases where we believe there are some new treatment coming for the next few years, but that will drive the cost up. So definitely when you look at the medical trend, yes, it's still going up. And it is the case in all geographies all across the world. So I don't see a major difference in terms of cost of care here. compared to the rest of the world. Now, in this period, obviously, we understand the constraint and the budget level. So we've created some more affordable solution in the region for SME, especially, where they can both access to all our expertise, knowledge, clinical condition capabilities, but at the same time, finding ways to reduce some of the cost with different factors and different solutions, accessing to different providers who will provide the same medical output, but at sometimes lower cost than the most expensive one in the market. So we can provide definitely different solution for different range of expectation in terms of budget level.
If I can just ask generally, Jérôme, not just about Cigna, it's quite clear that you've thought about this and you've produced some, you've thought about the needs of your customer base with new services, but generally, should companies expect premiums to go up? Because presumably the underwriters across the world are seeing healthcare claims, their risk exposure is increased. So generally, insurance premiums for healthcare will be going up. Is that a fact, or what do you think?
I think, as I mentioned, it will definitely go up. And if you look at the medical trend in all the countries in the world, actually, I've not seen any country in the world where it's below the level of inflation. It's always above the level of inflation for the reason I mentioned. So basically, you have the inflation factor for any single act, but then you have all the cost of new technology, new treatment that is adding as well. And obviously, all of us are more and more keen to be in good health, in good condition. So obviously, it drives the cost up as well. Last element to point out as well, there are a lot of lifestyle-related diseases as well, obviously that are unfortunately growing, like diabetes and others, that are also driving the cost up. So I think one of the elements, and again, if we can provide one advice, is more and more, I think the future is also how can we prevent more than cure? That's also an important factor. So how can we make sure we change our lifestyle? So it goes back to not only the stress level, but more broadly, how can we make sure we have the right healthy lifestyle that will impact positively the cost of care as well?
Maybe if I can come to Christine on this. Christine's been nodding as you were talking, so clearly you agree or have some comments following on from Jérôme. But just generally from me, as a healthcare company, do you think about the cost, in terms of the cost to your customers? Cigna is producing products from an insurance point of view, but do the healthcare companies look to bring the cost down as well? Maybe if you can just, explain why you were nodding to Jérôme's comments, and then you can answer my question after that.
What I like, basically what Jérôme was mentioning is it strikes a lot of coordination with the healthcare sector. A provider in the healthcare sector works together. It's not only increasing premium, it's also why does it increase, and trying to understand those data. And indeed, as Jérôme was mentioning, the big thing about the lifestyle is so important, and it connects to your lifestyle not only outside of work, but at work as well. So it connects to what Linda was mentioning. It's understanding that the way we worked in the past was not healthy. And it's not only about working, it's about even go back in time, it's at school, having students sitting in classroom for 6 hours, 4 hours, and just, walking to go to the next class. And now you even have a class where the teacher comes in and the kids don't move. So what does it, you start at a very young age where you don't move, you're sedentary, you just stay there. And that will cause issues if the kids do not do sports. And with the pandemic, that's what you've seen. Kids stay home, PlayStation, etc. Well, we can continue. It doesn't create the right behaviors and pattern of behaviors. Lifestyle is really important, and that's what we see in healthcare. We connect that, so we're trying to be more preventive. So the consultation, talking to your patient, and trying to educate the patient that, okay, you have that, if you continue like that, you're going to have diabetes. And it's not just giving a prescription, is how can you listen to your patient and also help them to look at how can they improve. Okay, maybe now a medication, but to go away from the medication. It's like medication for a certain period of time, but how can you change your lifestyle so to improve your health, and then reducing the cost or reducing the occupation in the hospital or clinics and such a thing. So that's really where we are going. And also digitalization is really important. I know having a watch can create anxiety, as Peter has mentioned. So again, awareness, like how can you recognize that you're too stressed? You have body reaction that you should be aware. Take the time, take a breather. Okay, my palms are sweating. I can feel my heart being going like this. I cannot think clearly. What is happening? Stand up, go have a walk, take a glass of water, relax, think about it. 3 deep breath. What is happening? Recognizing those signs can help a lot. So lifestyle awareness. I'm totally. That's why I was nodding. I'm like, yes, yes.
Richard, sorry,
yes, Peter.
Can I just add 2 points? Being an employer that does spend a lot of money on healthcare. So one, this is more of a response to the person who put forward the question, that look at your claims data and don't spend money on something that is not being used or extremely underutilized. We have situations in the past of people for bragging to have vision and dental coverage, which is very expensive to add them to the scheme. Year later, we analyzed the claims data, and hardly anybody or any of them used it. So we reduced the level, saving costs. So one, use your claims data. And the second one, which is more of a suggestion for Christine and Jérôme and everybody out there in the medical world, that yes, preventive, health checkups are extremely important. And I can suggest to anyone who has the room and the financials to build that into your medical scheme. But these are still looking at the physical attributes of a health, blood pressure, BMI index, and you name it, a whole list of different tests. I would assume that over time, because of COVID and because of the changing environment, these health checkups would some extent expand to the mental health topics or measuring certain things that are related to mental health, because those are going to be equally important and as your physical health. And then again, going back to the medical spending, if you have a strong enough preventive scheme built into your medical plan, that can save you a lot of money on a long run. You can't make it mandatory. Not everybody's going to do it. But again, it goes back to essentially to the theme of our discussion, making people aware that this is available for them through the medical scheme. More and more will go and get themselves tested, which is going to be good for Christine, going to be good for Jérôme. It's going to be good for everyone, because employers going to spend less, employees going to be healthy. Christine and Jérôme, they're going to be busy. So it's a win-win situation for everyone.
Okay, thank you. Now, we're coming to the end of our time. I just want to read out some comments, because some people have submitted comments as well as questions. So here is one. Thank you for the discussion. What has resonated with me as a founder of an SME, a small or medium-sized company? I have found, one, the hybrid model works best and flexibility is key. There is so much that we can control in terms of process and output. And with the pandemic, we've learned that flexibility is imperative, and many things are outside our control. So it's about the end deliverable, adopting a trust-based culture, which follows up from Linda's comment, and having consistent communication with employees. And that follows, I think it was Jérôme, somebody mentioned communication earlier. So that's one comment. Here's another question. Some companies believe having the COVID vaccine will impact positively on workplace well-being, but what if this is considered stressful for some employees who do not want the vaccine? Okay, this is a slightly different topic, actually. Maybe vaccine. Jérôme, do you have any thoughts on should companies be promoting the vaccine or just stay out of that topic?
Maybe just one comment. I mean, obviously, we believe it could be stressful for part of the employees. We are about to launch a very innovative product where we'll, give some financial element in case of any adverse condition, just to show and to demonstrate the fact that we are absolutely confident on the positive impact of the vaccine. So I think it could also bring some relief in terms of stress level to people who are actually stressed to take the vaccination. I think that's important as well.
Okay, thank you. Now we've come to the end of the discussion part of today's broadcast. I want to thank the panelists, to Christine, Linda, Jérôme, and Peter, for their time and expertise. It's been a fantastic conversation. I mean, so many big topics. We clearly need to do this again to get into some more detail on that. But thank you to all four of you, and Jérôme, thank you to Cigna for making this happen today, for partnering with MEED for this broadcast. But for the discussion part, that's us. We've come to the end. Thank you, everybody, for your time. Hopefully this has been useful, and I think we should be coming back to this again and again. So please stay with us and send us your ideas for future topics and themes. Stay safe. See you soon. Thank you very much.
Bye.
Thank you so much.